We have Lyndia joining us from Spokane Regional Health District. Lyndia, will there be anybody else joining?
Just me.
Just you, okay.
Yeah.
All
so,
right.
Good afternoon.
I did want to just make an announcement. We had sent this this link out to a number of our county staff members, county team members. So if there is anybody that is watching that does have a question, please use the Q&A function at the bottom of the screen and type in your questions. Then we'll get those asked to Lyndia as time allows.
Great. Thanks for having me. I know that some of you have seen the presentation. And as of a week.
Oh, and if there's anybody on, please mute your phone so we don't receive any feedback.
So as of a week ago, it has changed somewhat. And so this is what I know current as of January 19th. So I'm going to cover the roles and responsibilities of vaccine planning, phases and tiers, the vaccine venues, a little bit about the enrolled providers, delivery and inventory, and then where our sources of information can be obtained. Next slide.
If we have anybody joining us on the phone, if you could please mute. It sounds like that's where our feedback is coming. It's from someone that's calling in by phone. If you could please mute your phone, we'd appreciate it.
Next slide. So there's some confusion around the roles and responsibilities of vaccine planning. And I just wanted to clarify that the state really is the lead on the vaccination program. They are the one that develops all of the guidance on the priorities and phases and the allocation. They recruit and enroll providers in our community and manage how the allocations of vaccine goes out. They distribute the vaccine directly to providers, and I will share a little bit more about that concept, and also are responsible for all of the education materials and media that's going out. So our Spokane Regional Health District role, or local public health, is really to augment what the state is doing. We encourage providers to enroll, and we also do oversee how they store their vaccine and if they're properly using it. We participate in a lot of partner planning to engage them, and really our role is to fill the safety net. We're not a healthcare provider, but we can actually get vaccine to those that have limited access. And then we also are looking for opportunities all the time to increase the access in the community. So we work a lot with our partners to set up drive-through clinics or vaccination, mass vaccination events. Next slide. So there's a lot of things to consider when we're planning vaccine. We look at the supply that's available. As we know, it hasn't been flowing as readily as we hoped from the federal government. But we have to really make some assumptions of that it's going to keep coming and that the supply is going to pick up. We also have to worry about the number of providers in our community that have actually enrolled to administer the vaccine. And then we're using this phased approach on highest to lowest risk groups. And in that phased approach, we have to kind of determine or estimate how many people will actually get the vaccine and if they will have different limitations to the access. We know that different populations are hesitant and that some cultures are more comfortable in some settings over other settings. So all of these areas or variables we have to take into consideration on how we do our planning. Next. So this is already out of date since I showed it last week. The state government has decided to move the 70-year-old population down to 65 and has defined the multi-generational households. So we currently in Spokane are in phase 1, tier A, 1, and 2. We are still really focused on our high-risk healthcare workers and our first responders, our long-term care facilities, and other workers that are in a high-risk setting. We'll be moving to B as soon as possible, but we really have to have the vaccine before we can move to the next phase. And we keep getting asked kind of when will that be, but we're expecting vaccine to increase over the next couple of weeks. So through this chart here, you can see we'll stay in phase 1, tiers A and B, probably through March or April. And then we'll move on to phase 2, 3, and 4 after those phases are taken care of. So one of the things to look at this chart is that we get the question around where does an essential worker fit? And for government, essential workers are kind of scattered throughout these phases. They're in each of the groups. And so when we look at whether a government worker or essential worker is qualified for a phase, we have to ask for a lot of different questions to determine if they're at high risk of getting exposed or they're high risk in giving it to others. And those are some of the questions that are asked of whether the essential worker would be vaccinated in early phases or later on in phases. For example, I'm a government worker, but I'm very low risk in being exposed and to exposing others that would have a high illness. So I probably wouldn't qualify until maybe even like phase 2. Next slide. So these are the recommendations of a statewide vaccination collaborative that's really looking at equity issues and some of the criteria that they're using to determine where people fit within the phases. So one, do people have access barriers to getting their health care? Are they at higher risk for exposure just because of their occupation or where they live? Are they providing care for others who are at high risk? People who live in areas with a lot of other people, congregate sites are a higher risk, and they also may have lower access to vaccines or health care. People at risk for severe illness and people at risk of spreading it. So I'm just pointing these points out because that is how really those phases were determined and how it was decided that high-risk people would get vaccinated first, and those of us that are less exposed or can expose others would get it later on. Next slide. So I just wanted to share some venues of where the vaccine will be provided. We will use our traditional ways, such as through our healthcare providers and pharmacies. And the providers themselves can decide whether they're going to be a closed pod or a point of dispensing, or they can be an open pod. And basically that just means that if you're closed, you have to be a member of that provider. And if it's an open point, you can be outside of that membership. Some of the sites will be stationary, and then we also know that some of the providers will be using mobile units that can go out to different areas in the county. Pharmacies are basically an open pod where you can go to any Walgreens or any Safeways, and you don't have to be a member. As of right now, 111, we know that there are 51 approved providers in our county, and a little over 110 have applied and are just waiting for approval. Then for public health, we also enhance the traditional venues with our own models. And we call them vaccine liaisons, where we give them the vaccine and they work under our health officer as standing orders. So we have given vaccine to the county Jill and Geiger, and they use their own staff to vaccinate their staff. We are working with some of the school districts and training the school nurses to provide the vaccine to their teachers and other personnel when they get to that phase. We use a lot of our universities in the area where we have the College of Pharmacy or Nursing, the medical school, and their clinical students can come and use our vaccine and operate under our health officer license. The emergency medical services efforts that were going on at the Fire Training Center was basically a vaccine liaison model where they used our vaccine, and then the EMTs were able to vaccinate different first responders. So it could be where they use a model of they come and get our supplies and vaccine, and we call it the pack and go model, and then they go out to different places like our shelters, our long-term care facilities, and vaccinate people. Sometimes we use school districts, parking lot, or we use the fairgrounds or different areas that we can use more of a curbside where you are in your car or it's outside. A lot of times we use our Medical Reserve Corps as the volunteers for those curbside models. We also contract with mobile units and put together drive-through clinics, which is what the EMS did at the Fire Training Center. Chaz is right now at the arena, and they will be possibly doing either a drive-through or moving it inside the arena. And then as of yesterday, the governor did announce that Spokane will be hosting a mass vaccination event using National Guards and some state resources, and it would be run out of our arena potentially, or we may be finding them an alternative site since Chaz is already at the arena. Next slide. So the vaccine flows from the federal administration, and it could go directly from the CDC or the manufacturer to the Department of Health, or it could go directly to a large provider system, such as Albertsons or the Providence healthcare system. And then DOH will then also send it to vaccine enrolled providers, which I had mentioned there are about 51 of them. And so that's how we get the vaccine here in the county. A lot of people think that we are the ones that's allocating the vaccine out, and it just comes to us just like it does anybody else, any other pharmacy. We are also a vaccine enrolled provider. So you can see on the chart the number of doses that Washington has received, and most of it has been distributed out through the state. Only about 42 to 50% have actually been in somebody's arm, so actually administered. And that number is going up all the time as we get more and more of these clinics set up and established and running. I don't have any updated numbers for how much vaccine is in Spokane County. The state is working on that and that data, and hasn't updated the numbers most recently. Our health department has received about 5,000 doses, and we've administered about 90% of our original allotment. And then just today we received 1,200 more doses. Next slide. So this is just the last slide about where people can go for information. There is a state playbook that's basically a plan, and it's based on the Centers for Disease Control information. And we also have a plan that we based it on the state. There's a newsletter that anyone is welcome to sign up for. It's a weekly newsletter. It has a lot of good information in it. And then if you go to the DOH website, there is a lot of materials, apps. They have a dashboard, and their dashboard as of tonight should be live and include all of the vaccine information that's been distributed and administered in the state. So you can actually see how many people have started their doses, completed them, and the percentage of the population that has had the vaccine. They are doing statewide media campaign that you probably have seen on the TV, and we help support that campaign. So for locally here, if you want as local information that you can get, you can go to our website, and we try to keep it current. We worked really hard on it last week to make sure that when somebody goes, they can see how to find out when they'll get the vaccine and where to go. And I know Commissioner Kearns, that was one of the things that you really wanted to see. So we worked hard on that. We also use a statewide call center that people can call and talk to somebody about where they would be in the phases. So I think that's it, unless there are some questions.
Yeah, again, if there's anybody that's on Zoom that would like to ask a question, please use the Q&A function. And we do have one question that's queued up. I'll just read it word for word here for Lyndia. It says, just to clarify, Spokane County is in phase 1A, or I'm sorry, A1 and A2, correct? It says we are not yet in B1.
That's exactly right. So in a clinic, if they do have vaccine left over at the end of the day, they don't want to waste it. So they will grab people in the 1B area, but not until we get through the first phase A or tier A. All those numbers are confusing.
Okay, and then we have another question here. Again, I'll just read it word for word here. What is to stop someone that is not yet entitled to vaccination to go to, for example, Safeway pharmacy and get the vaccine?
So we were using a voucher system, and it's a little bit cumbersome. So we will be moving to using Phase Finder, which the state has rolled out. And then individuals will have to show where they landed on Phase Finder and if they're eligible for the vaccine. If it's age driven, then you would have to show a form of ID showing your birth date.
Okay. Okay. And then have another one that came in through the chat function. It says, do Spokane County employees that reside in Idaho receive the vaccinations from Washington or Idaho?
Complicated question. It kind of depends on your occupation. So if you are at risk because of your job, then I would say use Washington. If there's a reason why you need to be safe because of your personal life in Idaho, you may want to go to Idaho. I'm exact same situation. I live in Idaho, and I kind of have to look at where it makes sense for me to get my vaccine.
Okay. All right. So if there's anybody else who would like to ask a question, again, please use the Q&A function. So if we'll just give that a few more seconds here. Is there anybody else on Zoom that has any questions? Commissioner French, Commissioner Cuny?
I see you just got one more question there, Josh,
Okay.
that came in, but I just want to say thank you, Lydia, for coming in and giving us this presentation, because it's been very confusing for a lot of our citizens to understand kind of how this is all working. There's a lot of people that think our local health district has a lot to do with it, where we're kind of, just helping the State Department of Health, but it's all, flowing through from the feds down to the State Department of Health. So I just want to say, thank you for, I know you're going to be doing this to other organizations and just kind of, getting the word out there as to how this is happening and how the rollout is going on. So thank you.
Great, you're welcome.
So I did go on the website and signed up this morning, and it gives you a screen that says, thank you, Mr. French, you are eligible to get COVID-19 vaccine now. And then, but you have to take a screenshot. And so I did the screenshot. And so now the process is I just find a distribution location, whether it's, either the Coliseum or Walgreens or Safeway or Albertsons, walk in and show them that I've got I know the secret handshake, and they should shoot me up. Is that pretty much it?
Yes, so I'm not sure what phase it said that you were eligible for. Making sure that the place that you go is giving them beyond the 1A group. So like I mentioned, Spokane hasn't moved much beyond that because we're still vaccinating our first responders and healthcare workers. And so some of the places haven't moved into the next group yet. So just make sure you ask before you go if they're accepting your phase that you're in.
Okay, thank you.
And Lyndia, we have another question here that says, are public defenders considered front line for priority?
I believe they fit within the law enforcement group as essential workers and higher risk. And so I believe that's when they would be called into it.
Okay, and then have another one here that says, does support staff in the sheriff's office classify in 1A? Or I'm sorry, A1. Sorry, I keep mixing those.
Yeah. So again, it kind of it's based on their risk. And when you go through Phase Finder, it'll ask the person whether they have the capability to be away from others, to, social distance or work from home. And if they answer yes to some of that, then it will bump them down and they shouldn't get it right away. So it's based on risk and really trying to get to those that are most at risk first, and then save it for those that are less at risk later. Okay. If any of those staff are 65 and older, of course, then they are eligible earlier on.
Okay. All right. And then we have another question here. After receiving your first vaccine, what's the process for getting your second vaccine?
So what I understand is most of the healthcare providers or venues are giving a card out saying when your second dose is due, and they'll either say come back to the same place, or they will say that you'll be notified on where to go. Okay. So for example, some of our 1A staff got it at the fire training center, and the fire training center will be having the second dose clinic in February. So we'll send them back to that site.
Okay. So to clarify, Commissioner French, when you just took the survey, so that was the Phase Finder survey that you took?
Yes.
How long did that take to complete?
Well, maybe a couple minutes. It was actually pretty simple, pretty straightforward, even for somebody of my my youth. So it went pretty smoothly and stuff. So yeah.
Okay.
So a question for you. So if you're going to travel, and let's say you've got both vaccines, both doses, do you get a card or something to show that you've been fully vaccinated and that it's safe to go on a plane, or do you still have to provide some kind of a 72-hour test that shows that you don't have COVID?
Good question. From what I understand, you do have to show some type of paper that you've been vaccinated, and some are requiring that you still have a negative test 3 days prior. So I haven't heard a change in that, but that was the latest that I heard.
Okay.
Okay. All right. I don't see any more questions coming in, so I will give one last opportunity. Anybody on the Zoom call? All right, I think that's it. Lyndia, thank you so much for the presentation. Very, very valuable information. We will use this as a tool to probably crop down this video and send it out to our team members here at the county. But a lot of great information. Again, thank you very much for taking the time to share this with us.
You're welcome. Thank you.